Medical Matters with Dr. D. Thursdays, 7 to 8 p.m. on Capital 88.1 FM. Dr. D on Capital 88.1 FM.
Hi, if you've just joined me, it's Dr. Devshni Chanan on Medical Matters on Capital Radio 88.1 FM. And it's just gone 1940, and we're talking about obstetrics and COVID-19 and all the questions that you want answered. We have our specialist, Dr. Cassandra Govender, in studio with us. So remember, if you have anything that you want to know, if COVID-19 is affecting you, if you've just found out you're pregnant, or you just want to know in preparation, what do you need to do? You can always contact us on our WhatsApp line, 065 4211 380. So we're going to go back into COVID-19 and talk a little bit more about what happens in pregnancy. So with moms that are pregnant and are close to delivery, how does being positive affects their delivery in terms of what do they do? Is it going to change in any way?
So even better, even more good news. We're bringing the good news today, Desh. So yes, this mom has COVID-19. She's been diagnosed, but say in 3 days, it's her delivery date. That's her due date. And we mark her due date as the 40th week or the 38th week, depending on whatever. Nothing should change in terms of her delivery as long as she is clinically stable. Okay. So just to break that down for everybody, if a normal delivery was planned, if a normal vaginal delivery was planned, we will go forward with that. There is no reason for this mom to need an operative delivery or a cesarean section. In fact, we'd prefer not to have an operative delivery. We would love her to continue on in the natural process. Mm-hmm. However, if there is a reason that requires her, an obstetric reason that requires an emergency operative delivery, then by all means, we will treat her as we would have a patient who isn't COVID-19 positive, who now has an indication for an emergency delivery. Mm-hmm. So it's business as usual with regards to the delivery. Okay. In the mom who has severe disease, that's a different kettle of fish. But therein again, we have protocols in place and a team in place to institute those protocols to ensure that mom and baby are delivered safely.
Mm-hmm. Okay, so my question is, we deal with patients that come in randomly sometimes. You know that not all patients are booked patients when they do come in.
Yes.
So say
Sure.
One of our listeners is one of these patients and they're now gone into labor and they're coming to our facility and they are positive. What do
Yes.
they need to tell us? Because remember, we all need to be safe in that environment. What is the information that you require from our listeners that might be positive and go into labor?
So what I want to know from them is, when did their symptoms start? When did is the positive test with us, or when did they test positive? Mm-hmm. So that's important because you want to get a timeline as to where they are in this course of this COVID-19 infection. Mm-hmm. Are they in that mid-inflammatory phase, or they are now at, the trough? Is everything, are we going to go into that sort of that post-inflammatory phase where most patients are relatively stable? Mm-hmm. That's the first thing. The second thing is, the thing that I ask all my, what's your most worrying symptom? What's making you the most uncomfortable right now? And I get really concerned when it's the patient who says, I'm really having difficulty breathing, doc. Or I'm not, this cough, it's just not stopping. I can't even have something to eat. This cough is unrelenting. That's the patient I'm most concerned about. And then my other concerns, just obstetric general questions would be, had she been receiving antenatal care before? Has she been on multivites? Just things that would impact on any pregnancy. Mm. Has she had an ultrasound done? Because that would guide me as to what I'm expecting in terms of gestation for this baby and whether this feels like this is the gestation we're expecting. Does she have any other risk factors? Like, do we have a mom who's pregnant, who's got COVID-19, but is also just a chronic diabetic or chronic hypertensive, or developed hypertension or diabetes during the course of the pregnancy? So those are all the things that I would really want to know in terms of the mom. And for the baby, I'd be very interested to know if the baby's moving the way she is aware or expects the baby to be moving. And if there's anything concerning about the labor process right now, is the pain of extreme intensity? Does she have any abnormal bleeding? Did her membranes rupture or did her waters break? And that sort of thing. But honestly, even if she didn't book with us, we have a protocol in place and we would follow it with any COVID-19 positive mom who presents to us for assistance. And the main aim of that protocol is to treat her symptoms, to get her to clinical stability if she doesn't come in stable, and to get that mom and baby through this process as safely as possible.
Okay, okay. So that will bring me to my next question. So that mom has come in. We have now taken care of her. We have delivered her baby, but she's positive. What is that interaction between a positive mom and a newborn baby? Do we allow it to
That
happen?
is such an excellent, excuse me, Desh. That is such an excellent question. There's this fear that the mom and the baby need to be separated.
Mm,
And honestly, I'm not speaking from my own emotional point of view. The World Health Organization strongly discourages that. So this mom and baby must be encouraged to room in together as usual. Here's the differences. The baby has to be well. For any mom, COVID-19 or not, if the baby is unwell, that baby is going to be taken under the care of the pediatric team. So a separation will be inevitable. And in that case, unfortunately, our COVID positive moms don't have the facility to visit their baby in nursery
mm,
during their isolation. And that's a sad scenario, but the pediatric teams across the board have been so excellent. They have found innovative ways to ensure they take pictures, they bring their phones across to the moms with the baby's pictures, they take videos. It's, you know, hats off to our baby doctors. Honestly, the pediatric team have just found wonderful ways to ensure that the mom is still in touch with her baby while she's in isolation. For the mom who doesn't require for the baby who doesn't require isolation away from the mom or care away from the mom, we advise rooming. The precautions that we want is when the mom is breastfeeding, she should mask and wash her hands before breastfeeding, wash her hands after breastfeeding, sanitize regularly, avoid kissing, which is a terrible thing. Everybody wants to kiss their newborn. I mean, who doesn't want to cuddle with their newborn? But it's something that we do discourage. Please, mom, don't kiss. Just wait for your isolation period to be over. But there's absolutely no need why there's no reason why she can't mask up and breastfeed that baby. Breast is best. The baby's going to need all of that breast milk and the antibodies in it. And there's absolutely no reason why she can't cuddle with her baby as long as she isn't actively coughing, etc., and she has her mask on.
okay, I'm so glad we've actually spoken about this because we hear so many different things. I've had colleagues, I've had friends who have had people tell them, pediatricians, healthcare workers that have said, listen, you must now stop breastfeeding. It's not safe. And that is one of the myths or discussions I wanted to have today because I think a lot of moms that are out there that are faced in a situation, it's quite heartbreaking, especially when you want to breastfeed, when you know how important it is to breastfeed, but you also don't want to harm your baby in any way, shape, or form.
Absolutely. So the question that would naturally come to any mom's mind is the COVID in my breast milk?
Mm,
That's actually a great question. So let me answer that. There and again, the evidence is as limited as our experience because we've only ever really been dealing with this for the last 10 or 11 months properly. There is evidence, there's minimal evidence, but there is evidence that COVID passes through the breast milk. But what we also find is that same breast milk was tested 4 days later and there's no more COVID. The baby who was being fed for that particular mom or in that particular scenario remained well. So there's absolutely no need to be concerned. Breast is best. We will continue for as long as the mom is clinically stable and the baby is well. We stick by our old rules. There's nothing better than a mom's breast milk, and really nothing better than a mom being with her baby. And I think that we cannot take away from the emotional and mental impact of COVID. And it's only heightened when that mom is separated from the baby. So as far as possible, we need to keep the mom and baby unit intact.
I'm so glad that we had this conversation about this. So basically, all we're trying to say, listeners, if you are listening to this, is that you can breastfeed your baby, but the usual protocols apply, where you will mask, you sanitize your hands, you avoid kissing baby, unfortunately, or you try, if you're coughing, you try not to go close to baby. It's the usual protocols that we will always use, regardless of whether you're positive or not. It's the same
Absolutely.
scenario. So you don't have to be scared of it because the evidence thus far does not prove that your baby will get COVID from your breast milk. And as we all know, especially newborn babies, breast is best. The amount of antibodies and all the nutritive stuff that babies need, especially newborns, is imperative that they get them at that time.
100%.
So there's going to be, we have this query and we have this conversation about the vaccine so often. And like we know, pregnancy almost puts people in a higher risk category, a sensitive category where they need to be a little bit more cautious. So when our vaccine does become available, is it advised that a mom take it, a mom that is pregnant?
So at the moment, Desh, most of the vaccines are still in the phase 3 trials. They're still being completed. So currently, as it stands, it hasn't yet been approved for pregnancy as it stands. However, it's not a live vaccine. It just has remnant DNA, basically. Not to go too much into the detail, but it's not a live vaccine. So as a general rule, live vaccines are the ones we stay away from in pregnancy. But to be very honest with you, we can't really comment on that until more research is done. So for the pregnant mom, the vaccine may not be the right answer, but we are hoping that she will automatically be covered by the herd immunity that will ensue because of mass vaccinations.
Okay, so since you mentioned it, we did do a show about this quite a while back, but to reiterate the consent or the comments about what a herd immunity is, do you want to quickly explain that?
Yes. So when we look at our population, let's divide them into the very young, so our newborns, the very old, the elderly, and the immunocompromised. And when I say immunocompromised, I mean I use that term loosely, but it's anybody who's at risk. So a poorly controlled diabetic, a patient who requires chemotherapy, that's a cancer survivor, or someone who is not yet in remission. And let's put our pregnant moms in that category for the sake of this COVID-19 vaccine talk. So this group is usually not approved for new vaccines that come out because you need more trials, etc. And the elderly doesn't have enough of an immune response as with the babies. So the point of a vaccine is you introduce sort of, how do I say it, a milder version or something similar to the vaccine or similar to the infection or something similar to the virus or part of the DNA of the virus. So you give it to someone in the form of an injection, and my immune system recognizes this virus particle or the DNA or the RNA, and my body starts producing antibodies. So they're saying, listen, the elderly, the immunocompromised, the cancer patient, the elderly, their immune system is not strong enough to mount that response. So they may have more side effects than actual immunity gain. But everyone else falls in a healthy category. They will automatically mount an immune response. So imagine a crowd of 100 people. And in that 100 people, 10 of those people fit in the high risk or the category of not for the vaccine. So the newborn and the elderly. If the rest of those people are all immunized, you automatically protect the at-risk population. Automatically, because they are less likely to contract a virus if everyone around them is protected from the virus. Okay. I'm not sure if I've explained that correctly.
No, you have. So basically, it's almost like you have a very vulnerable population in the center of a crowd, and everybody else is standing as guards. And it's because they've now been exposed and they have the antibodies to this, it's almost like shielding the population in the center because you now have that immunity that you don't pass it on to the next person because you will be able to handle it when you get infected because your body is now sensitized to it. So that's basically what herd immunity is. If you immunize the mass population, the fewer people that are at risk are saved because we as a mass population have antibodies to protect them. So it's our shield basically to protect them.
Yes.
So that's the aim of having vaccines being given to people. So the one question I've been asked constantly by patients is, what happens? Do I still take the vaccine if I've already had COVID-19?
So that's a real trick question. So this is what we know about COVID-19 so far, which is very unfortunate for anyone who's had it. I mean, you go through this mentally fraught period, and physically, for a lot of people, a physically difficult time, and mentally, and you come out and you think, gosh, well, at least I have the immunity. the bad news, and it's the only amount of bad news I'm going to speak about today, is that studies have consistently shown that 3 to 6 months down the line, you no longer have that immunity or those antibodies to COVID-19. So you've been exposed to the virus, but and we're not sure why. It could be for any number of reasons, viral load, etc. You just don't mount a big enough response to have consistent antibody protection down the line. So right now, as the evidence shows, and I'm really hoping that it'll change as everything is doing so frequently with COVID-19. Currently, just because you've had COVID-19 does not make you immune to COVID-19. So in 3 to 6 months from your infection, you are just as you at risk as the rest of the population.
Yeah, we have actually seen quite a few reinfection rates amongst colleagues that we've had.
Yes.
Because at the beginning, people would talk about it and we hadn't seen much of it, so we weren't really sure. But when the second wave had happened, we found quite a few people that had COVID before that now were reinfected with COVID.
Absolutely. And we must just put it into perspective. It's the reason why there's a new flu vaccine every season. I mean, if you've gotten the flu once last year and it was a bad flu, and if you've gotten the vaccine last year, why should I be vaccinated again? Because things are changing all the time. This virus is mutating, H1N1 is mutating, and so the SARS-CoV virus, it's not behaving too much differently from viruses that we are accustomed to. And we just know that it's evolving, but so will our responses.
Okay. So we're almost coming to the end of the show, but there's a few more questions that I actually want to get in before we have to leave. So one of them is, I am pregnant. Okay, be it a newly diagnosed pregnancy or further along in your term. How do I keep myself safe?
So, the instinct is to say, lock yourself in a room and stay there, but that's not practical. And it's also not mentally the right choice for any pregnant woman currently or for anybody in general. I read a very interesting article from an epidemiologist from the UK, and she broke it down so simply, and I want to echo her sentiments today, and I want to say this. Keep it simple. Stick to the basics. Hand washing, masking, and social distancing. And the same applies to the pregnant woman. In addition to these three basic tenets of addressing the COVID pandemic, please take your multivitamin, please hydrate, please eat healthy. Make sure you're getting your vitamin C in, make sure you're getting your antioxidants in. Keep up with your antenatal appointments. Do not be afraid. And always keep an open line of communication with your doctor if you are at all concerned. And honestly, don't be afraid to tell your family and friends. Listen, guys, I've got precious cargo on board here. If you're unwell, please let me know that you're unwell so I can make the decision for myself to distance from you until you recover. Whether it's COVID, whether it's the flu, whether it's just nasty seasonal allergies, I think we need to just, take that little bit extra precaution.
Okay. So just before we leave, I wanted you to just reiterate the multivites or the packs that people can have and what they should be getting from their pharmacies.
Yes. So currently, whether you're pregnant or not, if you want to help us in this fight against the COVID virus during this pandemic, I would say let's beef up on your vitamin C, your zinc, and let's beef up on your vitamin D weekly.
So do you want to explain, because look, the thing I find asked with patients is people are saying take different amounts, take different doses. And obviously as much as they multivites, you also can't have too much. They have their own set of effects that they have in the body. So what are the doses and how often should they take them?
So ideally you should be taking vitamin C at least 500 milligrams a day. So I just want to caution with vitamin C, it's a great antioxidant. It works well against any kind of infection. It's a great remedy, but you need to strike a balance between too little and too much. So a minimum of 500, and I wouldn't exceed 1,000 milligrams unless you are terribly ill, because you're going to end up with some gastrointestinal side effects which are not so grand. Zinc 200 milligrams daily should be fine, and your vitamin D is a weekly dose. So, the great thing about the pandemic is that it's led us to really evolve the way we do things. So now if you walk into a pharmacy, you're most likely going to see this pack, this COVID pack on the shelves. So you don't have to ask too many questions or worry too much because your friendly pharmacist has put it together for you and you can take it. For our pregnant moms, I think it's still important. It's really important that you get in some selenium. Those things are still as important, irrespective of COVID or not. I am really happy if anyone's getting in some their vitamin C and their zinc. That's good enough for me, for especially in pregnancy. You're getting your thiamine, you're getting your B12s, and you are getting a level of vitamin D in your in your pregnancy multivites anyway. So nothing, not too much to be stressed about. But that added vitamin C or the increased levels of vitamin C would really go a long way to assist in prevention.
Okay, I'm so glad that we had this conversation today. I think it's been invaluable, and I actually hope that we have answered any of the concerns that you, the listeners, might have actually had about this. Because I know it's a scary time. Pregnancy is a beautiful experience, and you want to keep your precious cargo, like you said, safe. And COVID-19 hasn't helped along the way because there's so many uncertainties, and you're trying your best to stay safe because you can't really lock yourself away and pretend it's not happening. So I hope that the tips and the advice that we've given you has helped. The one thing I do want to reiterate that Dr. Governor has said is please keep to your antenatal appointments. As scared as you might be to want to go into the clinics, as long as you are observing proper protocols, you're wearing your mask, you're social distancing, you are making sure that your hands are sanitized, you are relatively safe in that environment, and all healthcare workers are striving to keep you safe. And you are doing a disservice to you and your baby by not keeping those appointments because, like we said, with pregnancy, it's such a fragile time. Lots of things can change very quickly, and we just want to be on top of our game so that we can give you the best care possible. So, Dr. Governor, we have actually come to the end of our show. I don't know if you have any few words that you'd like to say before we have to say goodbye to you.
Thank you so much, Desh, for the opportunity once again to join you to speak about something that is really so close to all our hearts and at the top of all our minds for the last 10 months. I really want to take this opportunity to reiterate what you said, to remind the pregnant women out there, please know that your services as will continue. Do not be afraid. And a special shout out to you, Desh, and to the rest of the frontliners who are holding the line strongly every day, to our porters, our general assistants, our admin staff, our human resources, and our fellow medics on the floor. Really special love to all of you. May we continue to remain strong in this fight, and may we all emerge well and victorious at the end.
Thank you so much for joining us today. We love having you on our show. To all my listeners out there, I love
Thank
and
you.
adore you to bits, and I truly hope that you are safe wherever you are. Remember, this is your show, so any questions or topics that concern you is a concern for us. And all you need to do is drop us a WhatsApp on 065 and let us know what you want to have discussed. And we will get those specialists in studio so that you can ask the questions that you need to ask. So remember, wherever you are, to my frontline workers, we are with you. Be safe. Remember, stay indoors if you have, and only God if you absolutely have to. And when you are going out, mask up, keep your social distance, and be safe. We're gonna wait it out. It's a few more. We've got a little bit more of a battle on our hands, but we are gonna get there. So join me next week for another topic. So until then, stay safe, and we will chat